Hello everyone, my name is Jalal Abu Halimah. Today I'll present a systematic review for the role of intraoperative endoscopy in minimizing postoperative complications. Initially, there is nothing to disclose about this presentation. As you know, various intraoperative techniques have been adopted to identify and manage intraoperative complications. The utility of routine intraoperative endoscopy is not yet clear. We performed a systematic review to evaluate the role and effectiveness of intraoperative endoscopy in minimizing postoperative complications in bariatric surgeries. We searched Midline, Embase, Central, and other databases in April 2019 for a study that compared intraoperative endoscopy versus non-intraoperative endoscopy, and study that described intraoperative endoscopy for bariatric surgeries. The keyword include bariatric surgery, intraoperative endoscopy, leak, stenosis, and more. Primary outcome was rate of intraoperative leak detection, postoperative leak, and postoperative bleeding. Secondary outcome were reoperative rate, operative time, and length of stay. Random effect meta-analysis was used when appropriate. In terms of result, we had 11 studies met the inclusion criteria. 10 of them were retrospective and 1 study was an RCT. The overall mean age of the patients was 39.86 years plus minus 4.71. Female represented in 84.1% of the cases. The mean preoperative body mass index was 47.2 plus minus 2.4, and the overall intraoperative detection of leak was 3%. The 95 confidence interval was between 2 and 4%, and the heterogeneity was calculated at 81.6%. Postoperatively, the leak was identified in 0.41%, while bleeding was identified in 0.2% of the cases. The reoperation rate was 0.28%, and the mean operative time was 147.85 minutes, plus minus 44.81. The mean length of stay was 2.42 days, plus minus 0.57. Conclusion, we concluded that intraoperative endoscopy may allow for detection of leak intraoperatively. However, its efficacy beyond simple leak tests or overall utility compared to no leak tests is difficult to ascertain due to the lack of comparator trials and low leak rate. Overall, there is insufficient evidence to recommend its use. Thank you, everyone.